Good afternoon, Phoenix. Welcome to Good Life with Lance. You're Dr. Fitness. That's me. Welcome to the show. We're going to get right into the topic at hand. If you're a first-time listener, you're going to learn a whole lot about hormones. Whoa. And how they regulate everything. In fact, I've got cortisol going big time right now, driving from my house down I-17 to get here. Holy smokes. Driving about 5 miles an hour. Took me over an hour to get here with these crazy snowbirds driving down the freeway, cutting everybody off. Anyhow, I'm going to let it out here. Cortisol levels are going to drop here because we're going to get into hormones, how to be healthy, how to stay young forever. And I asked a special guest to join me today, my sister Carla. She's a registered nurse and also her specialty is in hospice. And she's got a little bit of time off. So I said, can you join me, Carla, today, 2,000 miles away, and talk about hormones? And when it comes to aging, what concerns seniors, that means us, she's not there yet, well, almost, is staying young. And hormones are instrumental in staying young. When we look at them, it's just not estrogen and testosterone. It's a bunch of other hormones. In fact, the body produces over 50 hormones. But we're primarily going to focus on the endocrine hormones that regulate metabolism that we all are concerned about as we get older. Because one of the problems that Americans are having is we're getting fatter. But why are we getting fatter? Is it our hormonal systems out of balance? Yeah, that's got a lot to do with it. And how these hormones are interrelated and how they work together as a group to keep us young. But of course, we're not staying young as we get older because they're way out of whack. Anyhow, Carla, welcome to the show.
Thanks, Lance. Nice to be here.
I can rant and rave about this stuff all day because I it's on my mind because I'm almost 70. And I don't want to get old. I want to stay young. And so, talk to us more about hormones and how instrumental they are in maintaining, not only youth, but also your health.
Big time. So they affect the heart. They affect the skin, obviously. I mean, there's a gazillion things that it affects. All I can say is as a woman that's already been through menopause, I feel that we are very dismissed in the medical world when it comes to hormones, and it's just one of those things that we have to go through. I have a book called Blind Spots, the Dr. Marty Pkwy.
Yeah, we heard of him. Yeah.
I pulled some notes from there. Unbelievable, some statistics. If you take HRT, hormone replacement therapy, your lifespan is increased by 3 years. You're less likely to develop Alzheimer's and bone fractures. 50% decrease in the risk of heart attack.
50% decrease if you started how long before menopause?
Within 10 years of menopause. 50%. There's a reason why women, once they go through menopause, they're at the same risk as men for a heart attack. I mean, clearly it has to do with hormones. And doctors are so afraid to prescribe them, and that's all based on a study that was done a very long time ago, actually, that was proven to not be true. Within 1 week of this study, of this press conference of a Dr. Jigsaw, I don't know who he is, but this is in the book, he came out and announced that HRT raised the risk of breast cancer. The JAMA study, which is short for Journal of the American Medical Association, came out and said that actually cancer risk was decreased with hormone therapy. Okay, and we're not even talking about the heart and everything else that comes along. Alzheimer's has been known to be decreased. Heart disease is known to be decreased. Why are we not stressing this for women? Why are women just pushed to the side? Oh, so just get over your hot flashes. Here's the great part about hot flashes. You know what they want to prescribe for hot flashes? Antidepressants. So they're willing to mess with the chemicals in the brain, but they don't want to mess with your hormones? And that's what's causing the whole thing? It makes no sense to me.
The same thing applies with male replacement hormones, testosterone. They food on that stuff for so many years. Okay, you don't need that. You don't need it. Your levels are high enough right at the bottom level. As you gain more body fat and your cholesterol levels go up and you become more insulin resistant, you develop diabetes. The same thing with men. Same thing.
Mm-hmm. Yes. And the same with the low estrogen. A woman holds on to body fat because that fat makes estrogen. It produces estrogen. So clearly it's not normal for a woman to not have those hormones. Otherwise, we wouldn't hold on to the fat to make them on our own, right? And then when it comes to testosterone, that's hysterical too. I had mine tested recently. You know, I've noticed since I've gone through menopause, I was on HRT. I've been off since about January, and I've seen a huge difference not being on it anymore. Okay, I was on Prempro. Huge difference. The brain fog is crazy. The skin dryness, the fatigue. I mean, it's just crazy. And the strength. Like, I have a hard time even opening a jar. It's ridiculous. So I thought, I'm going to get my testosterone tested. So I go into my regular yearly exam for my gynecologist. She tests the testosterone. I get it back. I go see my regular doctor yesterday. And my testosterone came back at a 9.
Whoa.
So the normal rate for a woman premenopausal is 9 to 55. For postmenopausal, it's 5 to 32. So I'm considered normal. But think about that, a 9. Men is 300 to 1,200. Can you imagine the difference there, what we go through as women? Like, and men wonder why their women aren't all over them all the time. We don't have any testosterone. I mean, this is insane. And then she looks at me like I've got two heads when I'm, like, trying to discuss it with her. She doesn't want to go there. She doesn't want to go there. She's like, at the risk of blood clots and stuff like that. You know, wow. I mean...
Well, we also know that low estrogen, along with low testosterone, puts you more in. Put it this way: you can develop insulin resistance more easily. Okay, and what comes from insulin resistance is diabetes. Now, what comes from diabetes is heart disease. What do you got there? A bunch of drugs to treat these problems that are created from an imbalance in hormones. That can be simply addressed by putting people on hormones, the proper amount, and monitoring them.
Yes, the proper amount, and monitored by a doctor. I mean, why do we have to go to a med spa to do this?
Right.
This is crazy. Physicians should know more about this. It doesn't make sense. In this book, he also says, okay, so he details on heart health how the hormones play a part. Estradiol, which is the body's natural form of estrogen, is oxidized to produce nitric oxide, which is a molecule that dilates the blood vessels, keeps them healthy and elastic, and prevents heart disease. As early as in the 1890s, doctors noticed women that had their ovaries removed developed heart disease.
Interesting.
Very interesting. And we don't talk about it. And it's sad that you can go into a physician's office and they don't even want to go there. Well, I think they're not even taught about it.
Well, that's the point. That's not their field of expertise. And I've noticed with the medical community, because I deal with doctors, some real good ones, is if they don't know much about it, they foo-foo it. They don't want to talk about it. So they don't want to recommend it at all, because instead of saying, I really don't know, you need to go to an expert in this field, and just say, it's not good for you. It's that simple. Okay, because just recently I've been dealing with a gentleman I've been working with for many years. I said, Jerry, your testosterone's really low. This is for a long time now. And he goes back to his doctor and says, you don't need testosterone. Okay. And then just in the last year, all of a sudden, the doctor says, you need testosterone. Levels haven't changed. Okay. What changed was the doctor's background. He basically dug into himself and found out these levels are very important to maintain, that his level, even though it was within normal range, was too low. It needs to be brought up. So what do? He puts him on testosterone. Okay. Now you get a debate right there, which hopefully we can talk a little bit about the different types of testosterone, different types of estrogen. You can have plant-based, bioidenticals. You can do drug-based. What are the differences? Why are they pushing one over another?
Or none at all.
Exactly. And now we're going to put you on hold. We're going to take a break. Okay, and after the break, let's continue with this topic. Okay, and let's talk more about what the hormones and their role in our health and aging are, how relevant they are. We'll be right back. Anyhow, my sister Carla is joining us. She's a registered nurse, and also her background's as a hospice nurse as well. And we're talking about hormones. And one of the things that we know, Carla, that these hormones do is they're interrelated. And we look at the number one selling medication today, Ozempic. What does it do? It's regulating hormones. They're playing with the hormonal system in the body to help a person control their appetite and lose body fat. So when we look at that in general, when you're playing with hormones, with something that is, well, put it this way, they're going to have all kinds of side effects from this drug. And when you're looking at hormones in general, in order for us to stay young, okay, and to stay healthy and to stay leaner, it's regulating these hormones by hormone replacement therapy, if I understand you correctly.
Yes. Yes. Here's the other thing for women, at least. How many women are out there that are prescribed thyroid medication based on symptoms and not on numbers? I'm sure there's plenty, because menopause is the same symptom, basically, as a thyroid problem. Okay?
Right.
Abdominal discomfort, palpitations, depression, numbness, tingling, insomnia, night sweats, hot flashes, all these things. You get that with a low thyroid.
Yeah.
Okay? And so it's very easy for a doctor to say, well, you know, your number's okay, but, you know, you're really having symptoms of thyroid. Let's do this.
Right.
Why are we willing to do that, but not – and also, if you're taking thyroid medication and you don't have a legitimate thyroid problem, that's actually bad for the heart.
It sure
It makes
is.
the heart weaker. And so there, obviously, because it's a medication as usual, right?
Right. Well, see, we also know that when estrogen is low, just like testosterone, okay, you have a more of a tendency to develop insulin resistance, and of course, that keeps you from converting the inactive T4 to T3, which is the active thyroid hormone. So they keep loading you up on T4, like Synthroid, okay, or levothyroxine, okay, not understanding it could be the hormones that are out of balance for aging people, like males and females, estrogen and testosterone. And here we go. No conversion, you keep gaining weight. Instead of giving them estrogen or testosterone replacement, all right, so they need less thyroid, which has all kinds of negative effects as well. It just makes sense. It just makes sense.
Yeah. And it's funny, too, because I don't know that much about thyroid as far as the numbers, you know, the TSH, the T4, the
Right.
T3. I really don't. Quite frankly, I've never really paid too much attention to it, but I did get it tested recently, and my TSH was pretty good. You know, it was on the lower range of good, and I'm good with that. But the T4 was literally the lowest it can be considered normal. So I asked the doctor about it, and she goes, I don't know, because I had my gynecologist test it, but I went to my regular doctor. She goes, I don't know. I don't usually test the T4. I only go with the TSH. So there's got to be a reason why the doctor tests the T4. Lance, would you know what that reason is? I mean, I'm sure it's a logical reason.
Well, they usually T4, and they usually test TSH, okay, thyroid stimulating hormone, T4,
right?
Okay, which is the inactive hormone, okay, and then they'll put you on T4, and they cross their fingers that it converts to T3, which is the active thyroid. All right.
Okay.
But very seldom do they test for T3. All right, so if your estrogen levels are low and your testosterone levels are low, because they're interrelated as well, it can affect, okay, the conversion of T4 to T3. Okay, because you can overload on T4 and not get a conversion and have heart palpitations and gain weight. Okay, so they have to test for T3 as well. Another thing they need to test for is how much insulin that you're producing, how much is circulating when you're not eating. And if the levels are too high, and of course many of the experts are telling us anything above 7, when your normal range is above 14 to about 25, I believe, that's normal. Okay, anything above 7, that's where the health issues come in. Also decrease in estrogen, which is regulated by insulin, and also testosterone too. And there goes aging.
And they definitely don't test you for insulin.
No.
There's no doubt about that.
No, and they can't.
Actually, even once you go through menopause, you would think that it would be a regular thing for them to test your estrogen and your progesterone and stuff, but they don't. They don't. You know, even if you still have problems, you complain of problems, they still don't test you.
Yeah, of course, because that's not their field expertise. They'll send you to an endocrinologist, and all they're looking at is numbers. Okay, they're not looking.
Here's the funny thing. So you were relating to insulin, obviously. The funny thing is, in the study or in this book, this doctor states that there's a 35% lower Alzheimer's in women that use HRT.
Right.
So the curious thing is they're calling Alzheimer's type 3 diabetes.
Exactly.
So it makes sense.
Yeah, when we look at also what Dr. Bickman, okay, he's from BYU. He wrote the book Why We Get Sick. Okay, he's an expert in Alzheimer's and research, and he says in his book Why We Get Sick that 88% of the population has some degree of insulin resistance. 88%. Okay, now what does that mean? Okay, and we know that most men and women over the age of 50, okay, fall in the category of insulin resistant, okay, or pre-diabetes, 80% at least. All right, so what's that mean? When we get older like that, estrogen's lower, testosterone lower, or both combined, here we go. More insulin resistance, increased risk of what? Type 3 diabetes, Alzheimer's, dementia, heart disease, cancer even, all these different things, okay? All right, they're all tied together to hormonal imbalances and doctors don't deal with it because that's not their field of expertise. Their field is to prescribe a medication to deal with symptoms of whatever they see in front of them from their blood work. But key things that they need to be checking for each and every time, they don't check for. They don't check for insulin levels. They don't check for testosterone or estrogen levels. They just don't do this. Just standard lipid profile. Okay, here, take a medication because your cholesterol is a little bit higher. That's about it. Mm-hmm. Mm-hmm. Now, I know you and I, we discussed a little bit about ivermectin and cancer. Mm-hmm. Can you touch on that a little bit?
So I ran across a podcast recently with a doctor. Her name is Dr. Ruddy. She's a breast cancer surgeon. And she was talking about how she had a friend of hers that referred a friend of hers that had stage 4 prostate cancer. And he was told he had 3 weeks to live. And he went through all the chemotherapy, all the radiation, everything he needed to do, and they couldn't help him. So apparently this doctor, she reaches out to him and she said, I don't know that there's anything I can do, but, ivermectin has been proven to be very effective with cancer. So she refers him to ivermectin. Within 2 months, his the PSA changed tremendously. Within 6 months, his metastatic lesions were disappearing. Okay. And then less than a year later, he was dancing again. So he had 3 weeks to live and then ended up where he came out of this. They found one spot on him, and that was it. And they weren't even sure if it was caused by radiation or if it actually was related to the cancer itself. Yeah. This is one study that she talks about, but she talks about all these other people. There's another doctor that was talking about ivermectin. He said that it doesn't seem to be effective if you use it alone. It seems like it works in conjunction with the immunotherapy treatments. But some of his stuff was he had a patient that had 25 tumors in his liver and took ivermectin and he went down to 3 tumors and he lived 2 years. He was up in age. The guy was in his upper 80s. What he said is ivermectin targets the tumor stem cells and it promotes cancer death. It inhibits cancer cell cycles, helping to prevent the formation of new cancer cells, and it promotes killing of cancer cells by inducing mitochondrial stress, and it prevents cancer survival by preventing new blood vessels, which transport the energy and fuel to cancers from forming near cancer cells. Because we all know when cancer starts, cancer knows no boundaries. Cancer isn't like a benign tumor where it just gets in an organ and it just makes the organ larger, right? But it can't go anywhere. Cancer knows no boundaries. It goes through all those blood vessels. So ivermectin is being proven effective, and it's like incredibly cheap medication.
Very cheap.
It's been around for over 50 years.
That's the key
thing. It's won awards.
That's the key thing.
I mean, why are we not? And I think part of some of this that came out with COVID, and they stopped. Ivermectin was a horse dewormer or something stupid that they said. They stopped letting people use it, and that's a whole other story. But I think because of that, it was like kind of off the market for a long time, and now it's starting to come back where they're starting to realize, hey, this might be really effective for cancer. I have a patient, he's not mine personally, but he's in my company, 46 years old, with rectal cancer, a tumor so large out of his rectum. Sorry, I know this is bad, but he can't sit.
Oh, geez.
He's 46 years old in hospice. Has anybody discussed with him ivermectin? I guarantee you not. I'm sure he's tried every kind of chemo, every type of radiation, you name it. But they probably haven't discussed this. And ivermectin is an anti-inflammatory.
Right.
And that's the goal of all disease in the body, isn't it? It's all about
inflammation. Yeah. And you talked about ivermectin prevents blood vessels from developing to the tumor, correct?
Correct.
Okay, there's a food source. Okay, we know that cancer cells are what we call anaerobic, literally lacking of oxygen, low oxygen level. Only thing you can metabolize at that level through anaerobic metabolism are glucose, carbohydrates, and a little bit of protein. You don't metabolize fat. Okay, and when people are on a high carbohydrate diet, they're feeding their cancer. And if this keeps it from developing blood vessels that feed the cancer, then the cancer cell can't get its food and dies.
Right. I wanted. That's why I told you I really wanted to just at least touch on this.
Yeah.
Obviously, I'm not no expert, but I really wanted to touch on it just so maybe it's going to take one person to hear that.
Yeah,
and it could maybe save their life. I don't know.
Because we're not making any claims; we're just stating information that's available, that's out there that they can dig up themselves. Yeah. And we look at this, and all these things are tied together, ladies and gentlemen. So listen to this closely. Okay, that lifestyle has a lot to do with regulating a lot of these different processes in the body of all these different hormones together, and how we fight off sickness. Of course, we all get older, so it makes it more difficult. Okay, but one thing we can change and deal with is what we put in our mouth and the activity levels. And many Americans, they stuff their face with junk. Okay, and they just eat all kinds of processed foods that are highly processed carbohydrates with chemicals in it. So you're giving the body a fuel to get it sick. And then we sit in a chair and watch TV all day. We're not moving around. Now, we're going to put you on hold. We're going to take another break, and we come back. Let's dig more into the cholesterol lies they've been telling us all these years, okay? Carla, welcome back to the show. I want to share a little bit from you from Healthline on resistance training. You know how I feel about weight training. I've been doing this since I've been 14. So resistance training can increase testosterone levels in older men, although the effects may vary. The study showed that older men experienced a significant increase in total testosterone after heavy resistance training. Another study found that in high-intensity interval training, HIIT training, or PHA, improved total testosterone by about 17% in sedentary older males. However, not all research agrees. Some findings suggest resistance training does not significantly influence basal testosterone in men. Overall, it does when it comes to high intensity. It says as people age, significant hormonal changes occur, impacting various aspects of health. Key hormones like estrogen, testosterone, growth hormone, and melatonin typically decrease with age, and suggests on here hormone replacement therapy and lifestyle changes are potential interventions to mitigate these effects. And of course, they don't talk about that either. And one of the things that we discussed briefly, you and I, when you were out here to see us, okay, is cholesterol and how big of a scam that is, literally. You know, with the misinformation or disinformation when it comes to healthy cholesterol levels in males and females in this country. And one of the ways they deal with that is to stick a person or a male or a guy or a gal on statin drugs, which have all kinds of effects. Mm-hmm. Can you talk more about this?
Yeah, so I mean, I just had my blood drawn recently, and I always had a fantastic cholesterol. In the past, I'd say 2 tests, my cholesterol has gone up. Well, guess what's different? I'm not taking HRT anymore.
Right.
Okay. And when I do research on it, it actually says that it will raise cholesterol in women once you go through menopause, and also your LDL will go up. And actually, if you don't follow a good diet and stuff, your HDL will go down. My HDL has gone up. I think that I do enough supplementation that it's actually kept that good. So my number, when you put it together, is actually still very good, and I don't stress about it. But if it was up to a doctor, just based on the cholesterol, not based on any of my other numbers, my triglycerides, my sugar, everything's good, they would put me on a statin. And there is no freaking way I'm going on a statin. I'm not doing it. I'm not going to suffer those side effects for what? For what? What is it? There's a doctor, I don't know his name off the top of my head, but he's a cardiologist that has done a lot of studies, and he said that actually studies show a statin only gives you 3 more days of life.
Yeah, that's about right. Mm-hmm.
3 days.
Studies are,
and you're putting that crap in your body, and it's just causing all kinds of side effects. What is it? Bone pain and ligament pain, and for what?
Muscle loss.
You know, and that's what I explained to my doctor yesterday. I said, my cholesterol didn't go up because of heart disease. My cholesterol went up because I went through menopause, and so I'm not going to take something that I don't need to take. I'm just going to keep doing what I'm doing and trust that it's working. And you know what? If it doesn't, God has another plan, I guess.
Yeah, one of the other effects of statin drugs is increase your degrees of insulin resistance as you get older. I mean, it takes a person who's non-diabetic and push them into diabetes. Okay, here we have insulin resistance. When you have insulin resistance, it affects the other hormones like estrogen, like testosterone, like thyroid hormone. Here we go, putting more weight on. Okay. Plus, it's the statin drugs also cross the blood-brain barrier. And your brain produces lots of cholesterol. For what reason? Protect the brain. The membrane's made out of cholesterol. What does that do? Increases what? Risk of dementia, risk of Alzheimer's. Here we go. Take another medication for that, too.
Yep. Take a medication to fix the medication.
Fix the medication, exactly. Now, we know, because back in the 1970s, normal cholesterol levels were closer to 300. That was normal. Then they came out with this stuff that says fat's bad for you. Let's shift from eat a higher fat diet to eating more carbohydrates. And what happened then? They brought the cholesterol levels lower. Okay, I think it was from 300 to 240. Now they want you under 200 and sometimes under 150. Okay, and all they're doing is pushing more people into the area where they need more statin drugs. Okay, to maintain that level. And what does that do? Increases risk of other sicknesses that we just talked about. And that, of course, increases need for more medications, and who benefits from that? But the big pharmaceutical companies, and the food companies who feed you the foods that make you that way in the first place.
Mm-hmm. And they don't ever really stress the ratio number. What is it? Cholesterol? What is it? Cholesterol?
Yeah, total levels of HDL.
Yes. They don't stress that. Mine is really good. My number's really good. So I'm like, I'm not changing anything. I'm just staying the way it is. No drugs. I'd rather not do that. And then, of course, the discussion of triglycerides and their relationship to heart disease in general, too. We know that's right in there with it. And, what we're finding and reading from experts that I've talked to over the years, that you don't want your triglycerides to be more than twice the HDL level. Okay, but normal lipid profile is under 150, which is way too high. Way too high. And they'll tell you that you don't want anything over 90 ever, because at that point you have more of the small, dense particles forming of LDL, which is the oxidized form of cholesterol. And, of course, my HDL is in the low 70s, and my triglycerides are in the upper 30s. Okay, so my HDL is more than twice my triglycerides, which is heart protective. And we know in general with women, when they're younger, they have a very high HDL and very low triglycerides. But what happens then is they age and estrogen drops. What happens then? It goes the other way around. Okay, here we go, gaining more weight, increased risk for what? Heart disease. Yep. And also bone fractures is tied to low hormones. 1 out of, I think it's 7 women will fall. No, 1 out of 3 over the age of 80 will have a fall. And once we fall, it's high risk for a blood clot, pulmonary embolism, things like that are actually more dangerous than the fall itself. So osteoporosis comes from not having, enough hormone. I mean, there's a million things that are tied to it. But think about it. If we took care of all those diseases with just one medication, we wouldn't need all the other medications, right? Yeah,
if they did hormone replacement, it would take care of a lot of problems. But again, a lot of your doctors aren't doing that because that's not their field of expertise. They just don't know much about it themselves, so they're not going to recommend it. Okay. And when you go to an endocrinologist, what they're dealing with primarily at that point is looking to see if you're diabetic or not. All right. And if you have an imbalance in the other hormones, they gave you a drug to try to fix that problem. Okay. But not taking into consideration the other hormones that balance that out in general.
I'll tell you, what scares me, I'm seeing a lot of people out there that are trying to take this Ozempic and what is the other one?
Wegovy, and they have Mounjaro.
I mean, I have a friend of mine, a friend of hers lost like 51 pounds.
Yeah.
Does she look good? Sure she does. But I'm like, oh my God, you know how dangerous that crap is? Wow, you might have to be on that for the rest of your life.
Well, yeah, they're telling you that's the case.
And the risk to the, what is it? I think I heard that it can actually cause the stomach to freeze up.
Yeah. Yeah, basically, you won't empty, the gastric system won't empty. It basically sits in your gut. Okay, and can cause all kinds of problems, along with affect the pancreas, cause pancreatitis. And you know what can come from that? pancreatic cancer. You don't want that stuff, gang. Increased risk of thyroid cancer. Here we're playing with one of the main hormones in the endocrine system, okay, glucagon, that they're basically trying to alter, and its effect on appetite, and stomach emptying, and blood sugar balance. They're playing with that. Right? And
it works.
Oh, yeah,
it works, but there's definitely going to be something that's going to happen because of it. I mean, you can't, the scary thing is people trust this, right? Because it works fast. People don't have the patience to do things the right way. They just want a quick fix. Mm-hmm. We're in a fast society. Let's just get it done. And yeah, it works fast, but you should question it because it works so fast.
Well, that's big pharma. They're making a lot of money off that as well. Mm-hmm. And they're going to continue to do that as long as people are willing to be suckers, and fall for that. But, there's no way. You have to do things naturally, let their body get into balance in order to make a lifestyle change. And taking a medication is not going to make a lifestyle change. It's just like taking insulin. When a person is a type 2 diabetic taking insulin, you're going to see them gain more weight from taking the insulin instead of changing their diet. And, of course, we know that insulin has an effect on the hormones we've been talking about since the beginning of the hour, estrogen and testosterone. You look at women, all right, who are insulin-resistant type 2 diabetics. What happens with them? Their hair falls out in a lot of cases. You have belly fat. They have high triglycerides, low HDL. They have an increase in testosterone, throws the balance off there, and a decrease in estrogen because they're messing with their endocrine system with a master hormone, insulin. And that's regulated by what we put in our mouth. That's called lifestyle. So you're looking at cholesterol metabolism, you're looking at estrogen metabolism, you're looking at thyroid metabolism, all these different things that are interrelated to lifestyle. And of course, as we get older, you have an imbalance there where you're not producing enough of some of these key hormones, what we call the hormones of aging, the hormones of youth, correct? Estrogen, testosterone, growth hormone, those are the hormones of youth. And if you can keep those in balance, what happens then, I know I'm talking a lot, it slows down aging.
Yeah. Collagen production and stuff. It's all. And listen, when you think about it, that's not just externally, that's internally too.
Right.
I mean, think about what it's doing to your organs and stuff as far as hormones. If you lose that collagen production, it's going to affect everything. That's why women have prolapsed bladders and prolapsed uteruses and all that other stuff, because we stop, our hormone stops. All that stuff that's going on the inside is the same as what's going on the outside. We start wrinkling up, we start drying up on the outside. It's happening on the inside too.
Just look at the skin. We're going to put you on hold again. We have to take a break, okay? I'm joined by Carla Dreher. She's a registered nurse. Her specialty is in hospice from Chicago, Illinois. She's my sister. And we're talking about hormones and aging in general. Carla, are you familiar with the study done at Tufts University comparing exercise to drugs when it comes to the effect on diseases like heart disease and stroke?
Not as well versed in it as you are.
Okay, they took 339,000 plus people and compared the effect of exercise compared to medications and found a better effect, or at least as good of effect, from the exercise versus the medication. Period. And they said to get a drug approved, this is 339,000 plus people. To get a drug approved, all they do research on is between 500 and 600 people to get the drug approved. That's it.
Wow.
And if it was recommended that these people exercise, they would have as good an effect. Now, we're not saying stop taking medications, ladies and gentlemen. We're not saying that. What we're saying to you, why don't you include exercise, in one of the things that you do daily to offset some of the effects that drugs can do when it comes to side effects. Period. And when you sit down with your doctor next time you go to see them, talk to them more about, can they do some hormone testing and see what your levels are. And understand, Carla, you can chime in anytime you want to, that when you look at blood work, it gives you parameters. Low levels and high levels. Low levels are not good. Middle level is the best. And too high levels are not good as well, meaning outside of the parameters, what they should be. So if they're telling you that your estrogen should be 9 or testosterone should be 9, and the top level should be, 72, Carla, for females?
32.
That's postmenopausal?
Yeah.
Okay.
Yep.
That being closer to 32 is better than being closer to 5.
Right.
Right. And the closer to 32 is more anti-aging.
Yes. And think about, too, with exercise, it number one, it probably, most likely, I would think for most people, it would help you sleep better.
Absolutely.
And the number one thing for health, honestly, I think is definitely sleep. I think sleep is it's there with diet as well. And of course, hormone, deficiencies will lead to no sleep, insomnia, and things like that, and brain fog. So exercise would help, with that as well. Not to mention, of course, for your heart and for strength and things like that. But it definitely would help with sleeping. It helps with attitude. It helps with your mood. You produce. I don't know how much more testosterone you produce as a woman. Honestly, I don't know enough about it, but maybe you might produce a little more, and that could help you with some mood swings, possibly by exercising.
Yeah, I think it's about 17% more.
It gets you in there with other people, and
it'll
never be bad for you. Put it that way.
Yeah, of course. When you go into gyms nowadays, who do you see? Nothing but a bunch of young people. That's basically it. It's not the older people in my age group. All right, it's younger people. And we're the ones who need it the most. Okay, of course, then you look at hormone replacement therapy. You look at hormones in general. One of the things that having normal levels of testosterone and estrogen is, as you said, sleeping better. One of the effects of aging, because those levels are off, they're low, is lack of sleep. What does lack of sleep cause? Increased levels of cortisol. What does increased levels of cortisol cause? More increased levels of insulin. What does that cause? Body fat. And body fat's a bad thing. Alzheimer's, exactly.
All tied in, right?
All tied together. So, I think hopefully the message that our listeners are getting from the show today, okay, get these things checked out and understand just because you're older doesn't mean you have to be older. It doesn't mean you're not going to, you can stop the aging process, but you sure the heck can slow it down. And the slowing it down means lifestyle changes. It means habits that you have to develop even at an older age. And look at the areas that we know that are affected by aging, which is hormone balances. Okay, estrogen, testosterone, thyroid hormone, things like this.
Lance, you said a key word in there, and it's called habit. And it takes 30 days to form a habit. So if people, if you just start and keep going for 30 days, there's a real good chance you're going to stick with it. Yeah, that's why most people, when they do their, first of the year, join the gym, they're gone by the end of 30 days. They can't stick with it.
Yeah, in fact, 9 out of 10 people within 60 days stop going. Mm-hmm. Yeah, period, after they join. I say, it takes 30 days to form a habit and 1 week to quit it. so which means if they stop doing it for a week, they stop doing the habit. Okay, so you have to stay with it. It's called longevity when it comes to making these lifestyle changes. This is where accountability comes in. When I first started training, that goes way back. You go to a gym, they didn't have trainers. Now there's trainers all over the place. Mm-hmm. They have about 130 plus different organizations that certify people to train people. And all you need to do is just take a course online, and now you're a certified trainer with no background. You don't even have to even exercise. You can become a certified trainer. And a lot of these certifications they don't deal with the aging body. They deal with the younger body because it's easier to deal with issues that are not so complex, because aging issues are complex. You and I both know that because you deal with that in hospice. Mm-hmm. Because you see the worst end of what happens when we have health issues from aging, or even at a young age too, for that matter.
And I can tell you this, and I don't say this in any judgmental way whatsoever, because I am so not perfect. But I can tell you this. If there's anything, people at the end always say they regret. Mm-hmm. They regret the way they lived. They regret that they didn't do this, that, and the other. A person with COPD, for instance, oh my gosh, I can't believe I smoked. Even though it was 50 years ago, I can't believe I did that. I wish I never did that. There's always that regret. But it's too late. At that point, it's too late. So why not make the changes now?
Absolutely. We're going to let you go, my sis. Love you.
I love you too.
Okay,
Thank you.
We'll talk to you during the week.